Hello everyone, welcome to Med Smashers. Today I am gonna discuss about a very important topic, dry eye. So let's start. Dry eye is an ocular surface disorder characterized by dryness of cornea and conjunctiva, irritation, foreign body sensation, redness due to deficiency of tear film. There are many causes of dry eye. Vitamin A deficiency, collagen vascular disease like rheumatoid arthritis, juvenile arthritis, polyarteritis nodosa, keratoconjunctivitis, biliary cirrhosis, Stevens-Johnson syndrome due to acetazolamide, congenital absence of lacrimal gland or surgical removal of lacrimal gland due to tumor of lacrimal gland or atrophy of lacrimal gland, sarcoidosis. Symptoms of dry eye: burning, stinging or itchy sensation in eyes, watery and redness, sensitivity to light, a sensation of having something in eyes and pressure behind the eyes. Both eyes are usually affected. Symptoms are worsened by activities where rate of blinking is reduced due to prolonged use of the eyes like prolonged reading, computer uses, driving or watching television. Because blinking coats the eye with tears. Sometimes symptoms increase and sometimes reduce. Symptoms increase in windy, dusty or smoky like cigarette smoke areas, dry environments, high altitudes including airplanes on days with low humidity, and in areas where an air condition, especially in a car, fan, heater or even a hairdryer is being used. Symptoms reduce during cool, rainy or foggy weather and in humid places such as in the shower. There are some complications like eye infections, inflammation, abrasion of the corneal surface, corneal ulcers and vision loss. Now investigation. There is a test called Schirmer's test. It quantifies the dryness of eye. First, a paper with marking is used for this test called Schirmer's paper. Up to 5 mm of the paper is folded, then this folded part is given to the lower fornix. Patient is asked to close the eyelid. Gradually the paper is soaked with tear fluid. Interpretation: if paper is soaked for less than 10 mm, eye is dry. If paper is soaked for more than 10 mm, then the eye is not dry. Principle of treatment is to preservation of existing fluid and supplementation of artificial tear. Preservation of existing fluid. Patient should avoid hot, humid climate. Sunglasses can be used. Punctual plug to block the drainage of lacrimal fluid. Punctual plug is used to increase eye tear film and also surface moisture. Supplementation of artificial tear. Carboxymethyl cellulose eye drop according to need, povidone, carbamar, sodium hyaluronate, hydroxyl propyl, methyl cellulose. At night, gel can be given like gentle gel, hypomar, polymer. So this is all about dry eye. I hope you have liked this lecture. If you like it, then give a thumbs up and subscribe to my channel. And I also have an Instagram account. I will put the link in the description box. Thank you everyone. Bye.